I've had even a family member who had lung cancer and no one knew.
Hi, Angie. Nice to meet you. I'm William Pao from Roche Pharma Research and Early Development here in Basel, Switzerland.
Oh, okay, hi. Nice. I'm also in Switzerland, in Geneva.
Tell me, I know you've been diagnosed with lung cancer. Can you tell me a little bit about that and how you were diagnosed? And
Yeah. So it was it's a long story. I'm going to give you the abridged version. It took 9 months for them to diagnose me. So, and now that like I'm part of lung cancer groups, I hear that that's a common thing, especially like I didn't fit the profile. I don't smoke. I was 37. It's, the same thing, like started with a cough that wouldn't go away. They're given antibiotics, inhalers, all of these things. And, I was coughing. It was to the point where I was staying up all night coughing. And and then I started coughing up blood. So I thought, okay, there's something wrong. I went to the ear, nose, and throat doctor. He did the allergy test. He said I was allergic to this and that. And it just kept getting worse and worse. And I got x-rayed. And the x-ray, they said, oh, you have tuberculosis. To me, it just didn't seem right. So, they sent me home again and, I'm like in and out of the hospital, like for 3 months. And so finally I go and I get, I have a pleural effusion. So I have liquid all in my lungs and then they take the liquid out, they get it tested. And then they said, it's malignant and I have stage 4 adenocarcinoma. And then I started finding more lumps. So now I'm back. I start chemo again. And I have radiation on the week after. So I'm doing chemo and radiation soon. So it's a lot.
Yeah, no, it's been a challenging time. But I mean, unfortunately, it sounds like your story is not uncommon. I used to be a physician also seeing patients with lung cancer. And I think because of your profile, your so-called profile, like you're young and you never smoked, it's not uncommon that people look for other things other than cancer at the beginning. Yeah, I mean, have you gotten once you tell people you have lung cancer, do you get like a stigma with that?
Oh my gosh, I went to the dentist and, the dentist like jokingly says, I was like, oh, you have lung cancer and, you're 37. What, did you start smoking at 1? And there's such a stigma attached to just cancer in general. Like, people feel like it's their fault or, when other people giving their opinions about, oh, you should try kale or, you need to do like all these as if it was something that you did or didn't do. And, the stigma is so strong. And so a lot of people suffer in silence.
Yeah, I think, we need to do a much better job educating the public. One is that as you probably learned, unfortunately, that about 10% of lung cancer patients actually never smoked.
Yeah. But what compelled you to get into medicine and cancer research and all of that?
Oh, yeah, thanks for asking, Angie. So actually, my father died of colon cancer when I was age 13.
Oh, okay.
And back then, there were very few treatment options. And I remember he got chemo and, he got really sick and he lost his hair. And so when he passed away, I vowed that I would try to make a difference.
Oh, wow.
Now, I didn't know how, but then after college and going to medical school, I got really interested in going into the laboratory. I got really excited. People call it getting infected by the lab bug. Because it's so exciting, and essentially that one thing led to another, so then I ended up being an oncologist, treating lung cancer patients, also doing research, and then eventually I headed up to Roche to develop drugs for oncology and other diseases as well, full time.
Okay, all right. Did you choose lung cancer, or it was just?
That's really interesting. So, I was a fellow. Well, in training, in medical school training, you go through med school and then internship and then residency and then fellowship. Fellowship is when you specialize. So I specialized in medical oncology. And at the time, lung cancer, this was back in 2000, showing my age now. And basically the modern treatment at that time was modern chemotherapy doublets. And, you know, many of us knew that we had to do better for lung cancer patients. And there were a lot of breakthroughs coming in science at that time too. And so because wanted to make a huge difference in a disease where it used to be a death sentence. And also because of the science that was coming, I decided to do lung cancer, both in the laboratory as well as in the clinic.
But I mean, you've been described as the world leading molecular oncologist, right? So, so it says like, you know, we're talking about, you know, the targeted therapies and personalized healthcare strategies using cancer genomics and the thing. So, I mean, I know what it means because, you know, I'm going through it, but can you explain a little bit more about that?
Yeah, well, I'm not the leading. Well, I was mentioning, you know, back in the early 2000s, the main options for cancer patients, especially lung cancer patients, was chemotherapy. And I mean, after first line chemotherapy, there was second line chemotherapy. That was basically it, right? But these new drugs were being developed. And then we and others found that they only worked in 10%, as I said. And then they worked in never smokers and also, you know, female, they tended to be female and also more likely to be Asian background. But it turned out that it was really the genetic reason, the EGF receptor mutations. So we were one of the first to find that association. And then I and others also found why the drug stopped working. So, you know, in patients with EGFR mutant lung cancer, it works for about a year. You know, the tumors shrink and it's not uncommon, like, you know, in 3 days, people feel fantastic. But then unfortunately, after a period of time, the tumors start to grow again. And then we found out basically why in half the patients it started to grow again, which was another mutation that happened in the tumor. And so from 2005, discovery of the mutation to approval in 2015, you know, in 10 years, we were able to figure out a way to overcome that resistance mutation.
Wow, that's great. You know, at first I kept my diagnosis to like my close friends and my family and stuff. And I was talking to my friend, like when I first got diagnosed, I spoke with my friend Carly, who she was diagnosed with breast cancer at 38. And she was one of my friends in my circle who I knew that she was, you know, a mom and quite young and had this, and I knew like she would understand and stuff. So we kept talking every week and she was helping me with my morale and everything. And I was like, you know, all of our conversations sound really good. We should record this, or other people should, you know, could benefit from it. So let's start a podcast. So we started a podcast. And we
that's the Mommy Had a Little Cancer podcast?
Yeah, exactly.
I was listening to a couple of your podcasts. How do you choose the topics?
It's random. I mean, it's just random. We just talk, and it's basically like what we're going through. So, you know, we had one about you know, chemo, and that's when I started the chemo. We have a lot of topics about kids, and the recent one we had my cousin Angie Brice, who's a therapist, family therapist. She was on, and she was talking about how you tell your kids you have cancer and your family, and how you protect your space and your self-care and all the things that go into it. Because when you have cancer, it's not just you, it's like your whole family and everyone, you know.
It's almost like a full-time job. Almost.
It is. I say that all the time, like it's a full-time job.
I think even a generation ago, you know, as you said, people didn't even talk about it, or they wouldn't even tell their kids or anything like that.
Yeah, I mean, my kids are 5 and 7, and, you know, we've been very open to them about it. And, you know, I'm lucky that I was able to, you know, talk with especially with my daughter. She thought that she gave me the cancer because, you know, she had a cough and I caught the cough from her. And so she's like, you know, I gave you my cough and then your cough turned to cancer. And you know, and we talked about it. And I was like, wow, I saved her like years of therapy. You know, like internalizing this. But yeah. And the other thing too, like I had one thing through my cousin came to visit me when I was sick, and she went back. She was telling her colleague whose mom had lung cancer about me. And then, so her colleague, he came up to her and he was just like, you said, your cousin had this ROS1 thing, like, tell me more about it. And so she was like, yeah, you have to do genetic testing and stuff. And it turns out that his mom like never got offered to do the genetic testing, and she went straight through chemo and she did it. And it turns out that she did have a mutation. And so, and she started taking targeted therapy. And I've been finding that a lot of people like don't have access to the biomarker testing, which is crazy to me.
Yeah, I think studies have shown, I think only like 60% of patients or something get molecular testing right now. So it does, if you find a ROS mutation or some of these other rare mutations, it totally changes the treatment options.
Yeah.
So yeah, I mean, I think we need to do a much better job of that as well. And at least, and also inform the doctors, right?
Yeah.
That these tests are available.
Yeah. So do you see are there any on the horizon, like any more targeted therapy pills for second line patients, or, for people like me?
Yeah, I mean, so there's lots of research going on both in academia as well as industry in terms of new therapies, specifically for lung cancer as well. I think the two main types now are these molecularly targeted therapies. And then there's a whole nother class called cancer immunotherapies.
Yeah.
And those are new medicines that harness the immune system to attack cancer. Yeah. But these are, a totally new paradigm that started in the 2010s, where it basically harnesses your own immune system, as I said, to have your immune system attack the cancer. And we're seeing survival rates in some patients that we've never seen before.
Yeah.
So there's a lot of research in terms of combos of, immunotherapy with molecular targeted therapy. There's advances in small cell. There are approvals of these cancer immunotherapies in small cell lung cancer as well. I think we also just need to have more fundamental research and understanding why these tumors start to get resistance.
Yeah.
In particular, like in your case, why do they get resistance with large cell instead of another mutation?
Yeah.
Hopefully we'll come up with some new therapies soon.
I know a lot of research is going into it, and before it used to be a death sentence, and now you're prolonging a lot more lives and stuff. And yeah, I mean, I'm part of a group on Facebook called the Ross Wonders, and they're really active, and you can ask the question in the middle of the night, and the people will answer you, and they direct you to like research experts on ROS1 and the symptoms that they have and what. So it's quite reassuring, and I think the pharmaceutical company should really work with the patients who are experiencing these symptoms and having them. Like, does Roche have a program where they have like patients?
Yeah, we actually work very closely with patient partnership groups, depending upon the different disease type. Yeah, I think it's critical. I mean, we have to understand what you guys are going through, and what's important and what's not important, and what important side effects do we need to think about. So I think the closer we work with you and other patients, the better we can make drugs of the future.
Yeah, sure. Yeah, and I'm, trying also to, while I still have energy to, to advocate and to help, and to be kind of a human guinea pig to the extent that I can be.
Yeah, no, it's really important. We can't do the research without those kind of samples. So thanks for that.
Yeah.
I think, patients like yourself and others really inspire us to work harder, to really try to make a difference. So thanks for everything that you're doing to educate us, despite your diagnosis and treatment.
Yeah. Yeah. Thank you. It's not every day that, you get to talk to somebody who's in the trenches and doing the research. And thank you for, your work in developing therapies that, save lives like mine. And, and you're also saving like families and, not just one person, but all communities. So yeah, thank you for your work.